He is also asymptomatic. These two cases met in Pakistan, but they did not live together. For case 1043 is a 47-year-old male. In early February, he returned to Pakistan to visit his relatives. He went back on his own, and then he sat with a cousin and also resided in Chunyang Estate with his cousin. But in Pakistan, he was separate from his cousin. 1045 is a 40-year-old male. He returned to Pakistan on the 11th of April together with his family and returned together. None of them had symptoms. Last night, after they got off the plane, they provided deep throat samples for testing, and they were sent to Chunyang Estate. He is tested positive today, and he will be arranged for hospital admission for treatment and isolation. Dr. Lau will brief you on HA's latest situation. As of noon today, in the past 24 hours, the hospital authority altogether reported 19 cases of suspected cases. Together with hospitalized cases, we have altogether 120 patients hospitalized for isolation treatment. In the past 24 hours, 12 more confirmed cases was discharged from the hospital. We, at the moment, have 349 confirmed cases and 1 probable case discharged from hospital. As of noon today, 93 patients are receiving treatment in 13 public hospitals, 1 in critical condition, that's case number 595, 4 in serious condition. They are 383, 461, 713, and case 857. As for the remaining 88 patients, they're in stable condition. As at 9 a.m., we had 1,231 negative pressure beds in operation with a utilization rate of 39%. We have 660 negative pressure wards with a utilization rate of 54%. So much for my reporting. So the floor is open. You'll be given a mic to ask questions. Please raise your hand and state the organization before you ask questions. Let's start with this one, Cable TV. I'd like to know whether there is any preliminary positive case today. It is rumored that there is a case now in Queen Mary Hospital. We'd like to know more details. As for the 4 confirmed cases returning from Pakistan, do they have relatives or close contacts requiring quarantine? What are the testing results? Are they now quarantined in Chunyang Estate or in other establishments? About this case, previously, this patient was admitted to Queen Mary Hospital. That's case number 410. On the 24th of March, the patient was admitted to Queen Mary Hospital because a week before, this patient had fever, and the patient was tested positive for COVID-19. On the 16th of April, after having 2 negative test results, the patient was discharged, and then at noon on the 5th of May, because of some ailments, the patient was suffering from stomach cramps and diarrhea. The patient was once again admitted to Queen Mary Hospital. Deep throat saliva test was again conducted, and the patient was tested positive for COVID-19. But the value, the CT value, was very large. It's 36. We sent the sample to the Department of Health for further testing, which returned positive again. I'm not sure about the number, though. The patient is in stable condition in the hospital. Regarding the 4 cases today, they have close contacts who stayed with them. They are now in Chunyang Quarantine Center. Because of the positive results, they will be regarded as close contacts, and they will be required to undergo a 14-day quarantine period. For 1042, there are 5 close contacts. For 1043, 1 close contact. 1044, 3 close contact. 1045, 4 close contacts. They are all family members. The preliminary test result, as I understand, are all negative. Next, that gentleman. Commercial Radio, good afternoon. I have a question. At the last press briefing, other journalists asked about this question. About the designated hotel, there was a problem of backflow of sewage water. Are the hotel rooms still in use? Is that only the phenomenon happening at the hotel? And also, by midnight tonight, some social distancing measures will be relaxed. Will you be concerned about community transmission? And if it happens, will you tighten the measure again? And what is your responsive action? I'm sorry I have not followed up on the hotel situation, but I think my colleagues are either in the process of following up or have followed up on the situation. I don't know the details, but I haven't heard of any major problems either. I believe the hotel is still in use. Regarding the relaxation of the prohibition of group gathering, these measures are gradually relaxed, and we will be closely monitoring any local cases. We'll keep in view of the situation and make a further recommendation for the government to consider.
Hi, Victor from. Several questions. Firstly, I want to ask about we know that there are about 300 people who would fly back from India very shortly. So can I ask if they would also be sent to Chunyuan Estate for quarantine, and how many available units are still there in Chunyuan Estate? And whether that is going to be a government chartered flight. The second question is, as we see 4 more cases today, are you worried about a potential resurgence of cases? And given that we know that some amusement parks like Ocean Park will also reopen pretty soon, do you think it is the right time to reopen? And do you have any concern over the risk of infections? My final question is about the positive case that you have found in another discharged patient today. Can you confirm if this is the 10th discharged patient who has got positive result again, and whether or not you are worried about the reinfection risk? Because if we look at the dates, we can see that the patient has got a positive result about 3 weeks after he has been discharged. So is it worrying that that is the case? Thank you.
I understand the Security Bureau is working with the India to work out a charter flight to bring back some Indian Hong Kong residents who are stranded in India, but the exact details has not been released. Has not been confirmed. So preliminary, I think we will also, because we are not sure about the situation in India and we are worried about the COVID situation there, so we may consider to put these Hong Kong residents under a quarantine center to observe for a period of time and decide whether we need to release them earlier. And the quarantine center facilities, I understand we have more than 3,000 units in the 4 quarantine centers, and the usage at the moment is around, the occupancy is around 500 to 600. The units have been used, so we have quite some capacity to accommodate these passengers. So concerning the infection case, maybe you can elaborate.
Sure. Yeah. Okay. The case number 410, who was first admitted to the Queen Mary Hospital in the 24th of March this year because of a fever for a week. And he was discharged on 16th of April this year after the 2 consecutive tests of COVID-19 negative. The patient presented to the Accident and Emergency Department of Queen Mary Hospital on 5th of May because of some abdominal pain and diarrhea. He was admitted to our hospital and found to have a positive result in the COVID-19 in the throat saliva, but the CT value is very high, nearly 36. And the expertise consider that this is the residual virus left in the patient's body, which is not infective and which is not likely to be reinfection at this moment.
Yeah. Oh, yeah. Because the recent cases are all imported cases directly picked up at the airport, so they have not stay in the community. So I think the risk for local transmission is very low, except for those close contacts who are now in quarantine center. So I think the situation has not changed in the past few days. And I would like to supplement about the positive case, because yesterday our scientific committee on emerging and zoonotic diseases has reviewed the latest scientific data on COVID and the virus. And the latest scientific evidence suggests that some people might have prolonged viral shedding, and however, the viable virus was not detected by viral culture after 10 days, in spite of persistent positive PCR tests.
下一位呢邊先啦，呢邊個合埋邊個位後邊。
HK, so a few questions. Because we are easing the social distancing measures tomorrow, so would you be worried that there will be a surge in local cases? And about the positive patients, so I think Dr. Lau mentioned last time that you will be looking into whether tests will be done on the recovered patients, and you will be discussing that with the experts. Could you let us know the progress and if that is a possible option that you'll be doing? And thirdly, about the changed rules on discharging patients. So now you don't need to have 2 consecutive negative results for the patients to be discharged. Would that be a more dangerous thing for the patients and the community? Thank you.
Mm-hmm. So concerning the relaxation of social distance measure, we will closely monitor the situation and whether there are any local cases or possible local cases arising from the relaxation of these measures, and we'll adjust the measures if necessary according to the latest situation. So our scientific committee on emerging and zoonotic diseases has met yesterday and examined the latest scientific evidence on whether the virus will be viable from a patient. And available evidence show that this virus usually are not detected after 10 days since the onset of symptoms of patients. So, but some patients may have persistent positive PCR for a long period of time. And so we have revised the discharge criteria to include the patient has to be stayed in the hospital for at least 10 days after the onset of symptoms. So this is an additional criteria in addition to the previous criteria of 2 consecutive negative specimen. Yeah, but we add another criteria is that if in case the patient has stayed in the hospital for a long time, it's more than 10 days since the onset of symptoms, but he or she has persistent PCR positive despite the CT value is very high, they can check the serology, the antibody. So if the antibody turns positive, usually it's after 10 days, then he can be discharged. So this is based on the latest scientific evidence. Yeah.
For the testing of the viral culture of the positive cases so far, there was no growth of virus. That means that the viral culture was negative so far for the test of the affected patient we admitted to our patient and found to be positive in the COVID-19.
好，喺嗰邊。
你好啊，明報去方文㗎。
Thank you, Ming Po. First of all, I'd like to ask about an extension of the mainland quarantine till June 7th. So would you also consider extending this in Hong Kong? Because some people are worried that after the expiry date, then those who are healthy or who have a healthy declaration in Hong Kong do not need to go through the quarantine measures. Would that actually increase the risk of imported case in Hong Kong, mainland, and Macau? We also see some travel agencies starting to organize tours. What suggestions do you have for our residents? Should they be traveling right now? And would they actually increase the risk of imported cases if they travel outside of Hong Kong? In Macau today, they're requiring residents who go over to Zhuhai to test on a frequent basis. Would Hong Kong also consider doing that? And would you discuss this with the hospital authority about that? Well, you have added in supplementary criteria before hospital discharge. Can you tell us which cases have gone through these extra criteria before they were discharged?
For CAP 599C regarding quarantine order for arrivals from the mainland, it will expire on the 9th of June, but I think that we need to look at the latest situation before we consider whether this should be extended. At the moment, we do not have details of the specific arrangement. As for whether it is possible to have mutual recognition of the health certificates, we need to discuss with the counterparts on the Macau and on the mainland. For the three places, there may be different circumstances and different testing requirements. For outbound travel, at the moment, we have quarantine orders in place. If you arrive from a foreign place, you need to observe a 14-day quarantine requirement. I think the same applies to other countries. You need to observe the quarantine period before you can travel. So perhaps we need to wait for a few months when we do not have any new cases. I need to make a correction. I mentioned just now, we at the moment have 943 confirmed cases and 1 probable case discharged. As today, we have had 12 patients discharged. At the moment, I do not have information at hand as to which of these patients was discharged according to the new criteria. This gentleman at the back. Economic Times. 2 questions. The scientific committee yesterday updated the criteria for discharging patients. When will the hospital authority follow up on the consensus recommendations? And about the repositive case in Queen Mary Hospital, will an antibody test be conducted? And among the confirmed cases today, 4 of them, are they all expatriate Hong Kong residents? And for 1042 and 1044, what relationship do they have, and how did they meet in India? Or rather in Pakistan. About discharging from hospital, we welcome the latest recommendations from the Scientific Committee on Emerging and Zoonotic Diseases. We understand that when new scientific evidence emerges, there would be new recommendations. The hospital authority is actively considering how we should revise our guidelines on discharging patients and to follow up on these patients. For the patients, apart from conducting tests with their nasopharyngeal samples, we need to arrange for tests of the antibody in their blood samples, and we hope the arrangement can be made as soon as possible so that patients can be discharged according to the latest guidelines. As for the positive patient who has been admitted to hospital again, we understand the CT value is very high, which means that the residual virus in his body should be non-infectious. He's been admitted to hospital, and we are arranging for different tests to be conducted. For example, blood sample will be taken, and he will also undergo a medical check. As for the presence of antibody in his serum, I believe in the hospital this arrangement will also be made for it to be tested. More importantly, we will consider the clinical needs of the patient and help him. The two cases, the 1042 is a nephew of 1044. They don't live together in Pakistan. But in the end of May, in April, as I understand, they met and had a meal together. Good afternoon. I'm Chen from Hong Kong 01. I have a number of questions about these new cases today and the flight they took. How many passengers were also Hong Kong residents returning? And do you know about the test results? Because in Pakistan, I understand there is still a lockdown. So did they pay for the flight expenses? And apart from the previous batch of 300 passengers returning to Hong Kong, how many of them paid out of their own pockets to fly back to Hong Kong? Another question, we have some positive cases. Experts previously have commented that whether or not they are infectious depends on whether samples could be taken and culture to be made to see if live virus can be found. So after accepting the recommendations of the Scientific Committee on Discharging Patients, will you arrange for viral culture for these patients who are to be discharged to make sure that they will not transmit the virus to others in the community? Now, we still have a number of imported cases at the moment. So is it the right time to relax the prohibition of group gathering regulation, or should we tighten it? The flight QR818 arrived in Hong Kong via Doha last night. Previously, the day before, we had a chartered flight that is QR818. Again, some passengers returned to Hong Kong via Doha, and these flights are scheduled to fly once every 2 or 3 days. And altogether, we have had 750 passengers returning to Hong Kong via the chartered flight, and they've been sent to Chunyang Quarantine Center. And for the flight they took last night, I understand that the test results are all available, and only 4 have been detected positive. But perhaps in the coming days, there may be other passengers coming back. They will be arranged to go to the quarantine center. We will consider the situation and see whether passengers returning from Pakistan might be of a high risk. We consider the fact that for these imported cases, it's still under control because samples are taken at the airport. And they're required to wait for the result, either at the quarantine center, at the hotel, or at the airport. This is so because we want them to stay in the community for as shortly as possible to prevent local transmission. So this should present a minimal risk to the local community. We had 9 patients being discharged, and then when tested again, they returned positive. Some patients were still in the hospital, but at that time, the requirement was that there should be 2 consecutive negative test results. So for those still hospitalized, we sent the samples for viral culture. All these results returned out negative. So our experts are quite confident that from the onset of the illness to when these patients are discharged, it's been quite some time. And for the majority of patients, antibodies are present in their bodies. So they are of the view that these patients should be quite safe. There should not be any infectious risk. As to whether further testing should be done in the future, first we need to consider the clinical conditions of these patients. If necessary, doctors will conduct tests for the treatment and recovery of patients. And I understand that for the Central Committee of the Hospital Authority, there will be further discussions based on the latest evidence and also the latest consensus recommendations of the Scientific Committee. We'll see if there should be advice to our frontline colleagues for their reference.
Now, TV, I'd like to ask about QR818 as it comes back from Doha. Well, some people did not take the lake from Pakistan to Doha, and they only took QR818 straight from Doha to Hong Kong. Are they still sent to quarantine in Chun Yung Estate? I also want to ask about the criteria for hospital discharge. When are you going to discuss this with the HA, and how are you going to adapt these new recommendations in the hospital operations? And that they will be tested for antibodies after onset for 10 days. Currently, we have also tested those passengers who only came directly from Doha, and they are sent to home quarantine after testing negative. The new hospital criteria was suggested yesterday after the meeting of the Scientific Committee, and we did discuss this in different platforms today. But as you all know, whenever we see any new recommendations, then experts will need to first discuss it. It will take some operational arrangements for the testing of the blood for antibodies. We would try to discuss this and then come up with a measure as soon as possible. This is also a clinical measure, and we will need to look into what kind of tests the patients will need to go through and what other tests to undergo before discharge from hospital. That's the lady in the back. A TVB. How would you set the period to be 10 days? Can you explain it to us? And there are quite a few chartered flights coming back. Would you suggest to the government to try to set a new set of measures for chartered flights? QR818 is not a chartered flight. The passengers paid for their own way. There are a couple of chartered flights before. I don't think there is really a connection between chartered flights or non-chartered flights. It depends on actually the place of origin, whether there is any outbreak in the place of origin. When we started our discussion yesterday, we decided on 10 days, mainly from evidence, from research. The viral culture is directly and closely linked to the onset of symptoms. And usually you'll be able to come up with a culture within 8 to 9 days. So when you start having symptoms, it will be easier for you to make the viral culture. And then by day 9 or day 8, you will be able to see the results. You won't be able to do that after the 10th day. So that is how we came up with the number 10. If there are no other questions, then we now close the briefing. Thank you.